I'm here with International Medical Advisory Board member Dr. John Vukich. John, like a number of your fellow board members, you travel the world for IMAB from your home base in America.
Yes, that's correct. We have a broad representation. I'm from Chicago originally. I have come here for this meeting. We have an annual meeting in which we get various input from around the world, and it's very valuable. We hear about the data that has been collected, the analysis, the talk about the current state of the art, and what are the things that are being done at the best level possible, and what can be done to both continuously improve the processes.
But what about your own business?
I'm a cataract and refractive surgeon, primarily cataract. I do a fair amount of refractive lens exchange. I've done about 8,000 refractive procedures and close to 20,000 cataract surgeries. I've been involved in over 20 FDA clinical trials as either principal investigator or as the primary representative for the FDA regulatory process. I'm currently involved with the Zeiss VisuMax trial for the treatment of myopia, as well as the AcuFocus corneal inlay treatment for nearsightedness, well, for the ability to see up close, presbyopia.
John, you're currently President of the American European Congress of Ophthalmic Surgery, Chair of Refractive Committee of American Society of Cataract and Refractive Surgery, and Associate Editor of iWorld magazine. That's a fair commitment.
You know, those are all things that I think enrich my professional career. These are the sort of things that allow me to give back, both with education as well as being able to continue to stay at the forefront of what is available with the technology to help develop new technology and to be on the cutting edge of refractive surgery and eye care.
Travelling to many parts of the world is a common theme for IMAB members, and you're married with 2 sons, so how does that globe-trotting fit in with family life?
I've been married for 28 years to my lovely wife Carolyn, who is incredibly supportive. She has a career of her own. She is a pediatrician, and so she understands some of the rigors with keeping up with medical education, as well as the importance of being able to give back, not just to individual patients, which is ultimately what we do, but to try and make the fields better. And she not only endorses that, she supports it. And it's been something that my boys have both enjoyed quite a bit as well, traveling with us. I have 2 sons, Matthew and Mark, aged 25 and 20, and they've grown up with this. So from that perspective, it's been a very positive thing.
And you're quite keen on outdoor pursuits, shall we call them? Sport?
Well, you know, we need a chance to relax. When we're in the operating theater, we are on task, and everything has to be blocked out, and you have to be in the moment, making important decisions and doing the best job you can. It's very precise, but it's the nature of what we do. And so maybe the other side of that is, how do you relax? How do you unwind? And there have been several things that I've really enjoyed doing, but 2 of my passions in life are skiing, downhill snow skiing, and bicycling, and that covers both seasons for me. With downhill skiing, I enjoy heli-skiing. I've been heli-skiing almost 2 million vertical feet, which is how they measure it. You know, basically it's one trip up and another trip down is about 5,000 vertical feet. So it's been quite a few runs in various places in New Zealand, in British Columbia primarily, but things that I think just drive a passion for, one, excellence in achieving some command of a sport, but the other is just the solitude and the beauty that attends to that. It's a wonderful thing. Same is true with bicycling. It's a great way to see the world, and it's something that we do as a family. I've come to the conclusion that walking is a little bit too slow for me, and driving in a car is a little too fast. But on a bicycle, I experience it's the wind in the hair and the smells and the sights in a way that you can, have the time to go a little further and see a little more as you do that, and that's been a great release for me.
The International Medical Advisory Board brings together the best of the best in refractive surgery. How do you see your personal input to IMAB?
It's a great honor to be a part of this group. These truly are the leaders in our profession from around the world, and we're all brought together to seek input, guidance, and consensus on what is the current standard of care, what is the best possible way to do a procedure to get the best possible outcome. And from my perspective, it's something that I gain enormously from. Every one of these meetings, I always change what I do in my practice based on the excellent research, thorough analysis, and the thoughtful contributions of the Medical Advisory Board. There's not been a single instance in which we haven't, in my opinion, advanced the quality of care for patients around the world. Very specifically for Optical Express, of course, this is why we're here, but this gets carried to all the practices, to all of the members who are part of this process, but it also influences the way we think about how we treat our patients. It also influences the things we want to concentrate on in research, the things that we want to pursue to make our patients' lives better. It is a very synergistic, cooperative environment in which I think I gain as much as I contribute, and it's a great process.
So let's try and look into the future for a moment or two. What do you see as the future for refractive surgery?
Refractive surgery is transformative. We have excellent procedures right now. We can address all refractive errors and we can make people's lives better. But like with all technology, we're getting better at the margins. A little faster, a little quicker, a little bit better. We're doing this extremely well now. What do I see for the future? The same thing I see in technology in general. We will continue to do what we do well. We will continue to try to do it better. And that's the only way to improve, and that is exactly what's happening.
And where do you see Optical Express in this?
Optical Express is on the cutting edge of technology. They are the first to adopt new technologies. They're the first to bring the latest equipment, the latest in diagnostics, the latest in treatment advances. And more than just the first to use them, they're the first to refine how they are used to their fullest advantage. The data that is accumulated, the way in which it is analyzed, all of this is done on a regular basis in order to ensure the best possible result. The attitude isn't we're doing well, the attitude is how do we do better? And that's why I'm a part of this. It is a dynamic environment that provides consistency of quality and the desire to improve what we're doing.
John Vukich, thank you very much.
Thank you, John. It's been a pleasure to be here.